Hey guys, shoulder problems. Many people have them and they can be difficult to treat. Maybe you're dealing with a shoulder issue right now and you're not sure what to do about it. In this video, we're going to talk about chiropractic's approach to shoulder issues and how chiropractic care could be the missing link in helping you to get better. Okay, the shoulder. The shoulder joint is such a unique joint because in its design, it offers a huge range of motion. I mean, it allows you to move your arm all over the place. But all that range of motion does come at a price, in that it makes the shoulder more vulnerable to instability and injury, which is why so many people have shoulder issues. Now, I opened this video saying they can be difficult to treat. The shoulder is a complex joint. There's a lot going on in there with all the muscles that not only help move the shoulder, but also help stabilize the joint along with the ligaments involved. That being said, I love working with the shoulder. Even if they can be challenging at times to figure out. But that's why I love the chiropractic approach to evaluating shoulder issues. Now, my approach to evaluating the shoulder is a little different than how I analyze other extremities. Yes, I still assess the shoulder itself for subluxation. In other words, checking the range of motion and feeling where it may be stuck or out of alignment. Now, if you're unfamiliar with the term subluxation, you can check out my video on extremities where I define it, and also the video on the 3 T's where I cover what causes subluxations. So the different approach with shoulder problems is that it is crucial to check the spine and the pelvis for subluxations first. Is this true with other extremity subluxations? Yes, but it is especially critical with the shoulder. Why? Because many times I find that a problem in the spine or the pelvis is either the cause of shoulder pain or the issue, or at least a contributing factor. Which is why sometimes people go in to have their shoulder evaluated and either find there's nothing wrong with it, even though they know it's not right, or if they do find something wrong with it and they go through treatment such as physical therapy, it may improve some, but it just doesn't completely resolve. Which is why it is so important to check the spine and the pelvis first. And you may wonder, how could a problem in my pelvis or lower back cause my shoulder to hurt? Well, as you know, all the parts of the body are connected. And if one part is off, it's going to affect all the other parts. For example, if the pelvis is out of alignment and actually locked up, it can actually limit the range of motion in the shoulder, which causes undue strain on the shoulder, which can lead to a shoulder problem. How does that happen? Well, one of the connections between the pelvis and the shoulder is the giant muscle in your back, the latissimus dorsi, more commonly known as the lat. You can see how the lat originates along the spine and in the sacrum and the pelvis and inserts into the humerus, which is your upper arm bone. Misalignments or subluxations in these areas can tighten that muscle and restrict movement in the arm and the shoulder. I also see a lot of neck issues that affect the shoulder. From a muscular standpoint, as we just described with the lat, the trapezius muscle, also known as your traps, connect the skull, neck, and upper back to the shoulder, where it inserts into the clavicle, more commonly known as the collarbone, and the scapula, more commonly known as the shoulder blade. And misalignments or subluxations in the neck and upper back can tighten the trap and affect shoulder movement. In the case of the neck and the upper back, there is also a neurological component affecting the shoulder as the nerves from this area supply the shoulders and the arms. Subluxations in the neck and upper back interfere with nerve function to the shoulders and the arms and thereby affect shoulder function. So, how do you know if a spinal or pelvic problem is contributing to your shoulder problem? Well, in addition to evaluating the shoulder, we also evaluate the spine and the pelvis for subluxations. In my video on Gonstead Chiropractic, I show specifically how I do that. If corrections or adjustments need to be made in the spine and the pelvis, we do that first before working with the shoulder. I can't tell you how many times where I've initially checked the shoulder and it was severely restricted in motion, and then rechecked it after making an adjustment on the spine or the pelvis, and it completely restored the motion in the shoulder. There are also times when there is a subluxation in the shoulder and we need to make an adjustment on the shoulder itself. But because we took the time to evaluate and clear out any problems in the spine and the pelvis first, we know for sure that the problem is coming from the shoulder and the adjustment was necessary. Now, are there other causes of shoulder problems besides subluxations in the spine, pelvis, or shoulder? Of course. As I mentioned earlier, the shoulder is a complex joint and actually made up of several joints, so they call it a shoulder complex. So especially in cases of injury, there is a time and a place to have it checked by an orthopedist, for there can be damage there and it may need to be repaired, as in the case of like a torn rotator cuff. And since there are a lot of muscles involved in the shoulder complex that are especially important in stabilizing the shoulder, physical therapy can play an important role in strengthening these muscles and also help restore more motion in the joint. So yes, dealing with the soft tissue components of the shoulder is important. We have a neuromuscular therapist in our office who is fantastic. And when soft tissue work needs to be done, whether it be working out trigger points in the muscle or dealing with soft tissue dysfunction, it works really well alongside chiropractic care in helping the shoulder to get better. So yes, shoulder issues can at times be complex, but chiropractic care is a key component in helping resolve shoulder problems. If there are misalignments or subluxations in the shoulder or problems in the spine or the pelvis that are affecting the shoulder, those need to be corrected in order for the shoulder issue to be resolved and restored to normal function. In the next video, I'm going to address a specific shoulder problem, frozen shoulder, looking at what causes it, what to expect if you have it, and how chiropractic care can help with it. So if you are dealing with any sort of shoulder problem, I encourage you to get it checked by a chiropractor. Or if you know someone who's dealing with a shoulder problem, I encourage you to like this video and share it with them so they can find out how chiropractic can help them. I also encourage you to subscribe to this channel so you can find out more about the different ways that chiropractic can help you and the ones you love. Thank you so much for watching, and I'll see you next time.